National Pet Cancer Awareness Month is marked throughout November by pet lovers from all across the country. 1 in 5 cats and 1 in 4 dogs are diagnosed with cancer every year. In addition, this month spreads awareness of how to prevent and treat cancer and other illnesses in pets. Joining us this morning to talk about it, Dr. Christian Broadhurst with Clay Humane, as well as our friend Sushi right here. And Sushi appears to be hiding from the camera.
Yes, she does.
She's like, where can I go so that people don't look at me?
Well, you're stuck. You're on camera, so you'll have to deal with it. Well, yes, certainly pet cancer is a very big concern. We are seeing lots and lots of cancer every year. It's partially a factor of the fact that our dogs and cats are living longer, living healthier lives, and with age comes cancer for sure.
So what are some of the common pet cancers that owners might see?
One of the most common ones is lymphoma, and it's very similar to lymphoma in humans, where the lymph nodes will get enlarged and your animal may begin being lethargic, being ill. Mast cell tumor is another very common skin cancer in dogs. There's a whole lot of them out there.
And there are some signs, there are some things that pet owners need to be aware of. Tell me about those, Doc.
Well, you are more aware of your pet than anyone else. You know when your pet is off. You know if there's a weird lump or bump or swelling that you haven't noticed before. And the only way to find out is to actually look. So certainly if you have a pet who's showing increased lethargy, coughing, difficulty breathing, inappetence, take them to your vet and go get them checked out.
Okay, and of course, you know, the vomiting, the diarrhea, also factors there that something is just wrong.
Something is wrong, and it depends on the cancer as to what symptoms you're going to see.
But you also don't want people to be too worried, because dogs and cats can sometimes have an off day.
Absolutely, we can too. I mean, I have people call me and say, hey, my dog sneezed today. Well, it's okay, let it ride, you'll be fine. But if you see something, weight loss over time is another big one. If you see weight loss or decreased, or you know your pet, if your pet is not right, get it investigated.
We were talking with Dr. Scott Ackerman from the Ackerman Cancer Center about human cancer just in the last hour, talking about early detection, early treatment. How do you make sure that's the case here when it comes to our four-legged friends? First
of all, keeping regular appointments with your veterinarian is very important, because we are the ones who are going to have our hands all over your dog, making sure that the lymph nodes are fine, there's no lumps or bumps or swellings. And certainly if you have an older dog, routine blood work is a great idea, because it will allow us to look at early organ function, white blood cells, make sure things are where they belong in a dog of your age.
So recently I had a friend whose dog was diagnosed with cancer. The dog's doing okay right now, thankfully, but she got hit with a lot of medical bills. What's your advice for people that maybe don't have a lot of money to spend on their pets? Is that maybe the case for considering insurance?
Yes, certainly there are. Pet insurance is still in its, I won't say infancy, but it's still a little, it's not very, very common. But there are great insurance programs out there that can help. You may also just start a savings account for your pet, because you know that at some point, if you have a young, healthy dog, you're fine. Put $10 a month aside. By the time your dog is 10 or 15 years of age and they're beginning to have problems, that can then turn around and provide dividends to you.
All right, Dr. Broadhurst, thank you as always for coming on, for
My pleasure.
Perspective, and thanks to you too, Sushi. You worked really hard during that segment.
She did.
She's trying to hide.
She's ready. Is there a bone over there?